Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today I will be speaking about what is burning mouth syndrome, causes, treatment, and prevention. If you are new to the channel, make sure to subscribe down below for more and more similar videos. So let's start now. Burning mouth syndrome. The medical term is glossodynia. Glosso means tongue, dynia means burning, which is equal to burning tongue. So it is a burning sensation on your tongue, roof of your mouth, or lips. It can happen anywhere in your mouth or throat. Burning mouth syndrome often starts seemingly out of nowhere. It may feel like your tongue is being burned by a hot liquid like coffee. There are two categories of burning mouth syndrome. We have primary and secondary. The primary is when burning mouth isn't caused by an underlying condition, and we will speak about the causes later during my video. Whereas the secondary is caused by an underlying condition, such as acid reflux and many others as well. Is burning mouth syndrome more common in certain people? Yes. It is most common in people in post-menopause who are over 60 years old. This is because reduced estrogen levels causes decreased taste bud sensitivity. Eventually, with time, you will have burning tongue. So what are the symptoms of burning mouth? Number one, you will have pain in your mouth that feels like tingling, scalding, or burning pain. Number two, numbness in your mouth, because once your tongue is burned, then you will no longer feel your tongue, which is equal to numbness that comes and goes. Number three, altered taste. You will no longer be able to distinguish sweet from sour. Lastly, dry mouth you will have, which is xerostomia. We said that we have two categories of burning mouth syndrome, primary and secondary. Now, what is the main cause of primary burning mouth syndrome? Nerve damage affecting the area of your tongue that controls taste and pain. There is a relationship between burning mouth and taste or gustatory changes. Many people with burning mouth have lost their bitter taste buds, which are located at the tongue's tip. Researchers believe that taste inhibits pain, but when people lose the ability to taste bitter flavors, pain fibers start to fire unexpectedly. People experience this pain as a burning sensation in their mouth. Now, what are the causes of secondary burning mouth syndrome? We have medical conditions that contribute to the secondary type. Number one is acid reflux. If you have a problem in your stomach, then you will keep vomiting, and with continuous vomiting, you will end up eventually having burning tongue. Number two, allergies to metal dental products or certain foods. So make sure to know if you have any allergy. Number three, depression. Because if you have depression, you will likely to take antidepressant medication. And the antidepressant medication, they will lead to secondary burning mouth syndrome. Number four, dry mouth equal to xerostomia due to the low levels of saliva, which eventually you'll have a burning tongue. Number five, hormonal changes commonly seen among the female ladies 60 years up and above due to the postmenopausal period. After, mouth infections. If you have any infection in your mouth, of course you will have a burning mouth syndrome. Next is nutritional deficiencies. What deficiencies of vitamin can lead to secondary burning mouth syndrome? I'll discuss it in my video. Lastly is teeth grinding or clenching of your teeth due to paroxysm or abstraction, both of which will lead to burning mouth syndrome, because sometimes you will not only grind your teeth, sometimes you will grind your tongue unknowingly, and of course, within a couple of seconds, you will have a burning tongue. Occasionally, people with Sjögren syndrome, and you know from my previous videos, Sjögren syndrome is an inflammation of the exocrine glands, which are the salivary glands and the lacrimal glands. So you will have dry eyes, dry mouth, and dry skin. Not only that, diabetes, thyroid disease, and liver problems, all these conditions, if you have any of these conditions, there is a high chance that you will develop burning mouth syndrome. Are there certain medications that cause burning mouth syndrome? Yes. ACE inhibitors that is used for treating hypertension, some antidepressant medications, and high blood pressure medications. All these will lead to burning mouth syndrome. The high blood pressure medications, such as we have Septropril, clonazepam, and many others, are contributory to burning mouth syndrome. Now, what vitamin deficiency causes burning mouth syndrome? Vitamin B12, folate, or iron, all these can mimic the sensation of burning mouth. So, under the vitamin B12, vegetarians, because they do not eat animal sourced foods, they are more susceptible to having vitamin B12 deficiency, leading to burning mouth syndrome. Now, how can I relieve burning mouth syndrome? You may find that sucking on ice chips, because you have a fire on your tongue. How to relieve a fire on your tongue? By cold water or ice chips. In addition to that, chewing gum helps with the discomfort, because the brain will no longer be focusing on the pain, it will be focusing on chewing gum. So it helps to relieve your burning mouth syndrome. In addition to that, topical or systemic clonazepam, which is a prescription medication, you may also relieve the pain as well. Here are effective home remedies for burning mouth syndrome. Drinking a plenty of water, especially cold water. Avoiding harsh substance. Use mild oral products. Do not use chlorhexidine mouthwash continuously. Give herbs a chance. You can eat herbs like lettuce, cabbage. All these, they contain the essential vitamins that will prevent burning mouth syndrome. Consider natural supplements as well. Eat a healthy diet. Make your food softer, not harsh. Lastly, reduce stress, because under stress, with time, you will have grinding of your teeth or clenching of your teeth, or not only that, grinding on your tongue, and this will result in burning mouth syndrome. Now, how can I prevent burning mouth syndrome? We need to avoid these things. Number one is alcohol. Alcohol, why? Because it will lead to dry mouth, and dry mouth will lead to burning tongue. Number two, high acidic foods or drinks like citrus juices. Number three, hot and spicy foods or drinks. Number four, mouthwash containing alcohol. Number five, tobacco products, seen among the heavy smoker patients. Lastly, make sure your diet contains enough vitamin B12, folate, and iron in order to prevent yourself from getting burning mouth syndrome. How long does it take for burning mouth syndrome to go away? Without a treatment, burning mouth syndrome can last for months or even years. About 1/3 of those with burning mouth syndrome will improve over 3 to 5 years without any treatment. Burning mouse syndrome treatment can provide relief within days or weeks. So you should consult your healthcare provider in order to know the best treatment for you. I am done. Thank you all for watching my video. If you enjoyed, don't forget to press the like button down below. If you have any questions, please do write it down in the comment section below and subscribe for more videos. Goodbye now.